Ireland's vaccination programme is designed to protect the most vulnerable in society, beginning with older residents of long-term care facilities. I wish to acknowledge at the outset the huge contribution made by all involved in establishing and commencing rollout of the vaccination. We are prioritising our most vulnerable to COVID-19 infection and health workers who care for them. They came first in the priority list for vaccination. Priority groups were approved by government based on public health and ethical guidelines. Vaccine has been rolled out to the initial cohorts outlined in the vaccine allocation strategy, including residents of long-term residential care facilities, frontline healthcare workers and those aged 70 and over. As of the 28th of February, 159,350 doses have been administered in long-term care facilities, and 62,654 residents have now been fully vaccinated. When a resident has been infected with COVID-19 or there has been an outbreak in a facility, vaccination may be deferred until it is safe to do so. The HSE continues to actively follow up with those residents and facilities where vaccination was deferred. As the Minister of State with special responsibility for older people, I can assure you that every resident of long-term care facilities will be offered vaccination once it is deemed safe for them to receive it. Rollout of the second vaccine dose to the majority of residents and staff in nursing homes is nearing completion. Vaccinations in residential congregated settings that were not included in the first series of the vaccination programme, such as unregistered voluntary and religious order service providers, will be completed as soon as possible. On the 15th of February, we began the process of vaccinating older people living in the community, beginning with those over the age of 85. We expect to be in a position to have administered a first dose to the vast majority of all those aged 85 and above by the end of this week. Following those aged over 85, the focus then moves to vaccinate people aged between 80 and 84 in a timely and efficient manner. Those aged between 80 and 84 will begin to be invited for vaccination from this week. All over 70s who wish to be vaccinated will be contacted by their GP and will be fully vaccinated as a priority cohort in the coming months. The vaccination programme is truly a national effort. By the end of this week, approximately 1,300 general practices will have participated in the programme. Without the assistance of GPs, it would not be possible to reach the most vulnerable in our community. I wish to thank GPs and their staff for their ongoing efforts, which will facilitate delivery of our programme. The vaccination programme is continuing to focus on vaccinating those most at risk of poor outcomes as a result of contracting COVID-19. The primary objective of the vaccination programme is to reduce mortality and morbidity, which in turn will protect the healthcare system from being overwhelmed. The vaccine allocation strategy deemed those most at risk to be those over the ages of 65 and residing in long-term residential care. I welcome the progress that has been made with regard to protecting this vulnerable cohort. As the Minister of State with responsibility for mental health, I am pleased that NIAC's updated vaccine allocation strategy was approved by Government last week. The strategy will see those with severe mental health illness, including schizophrenia, bipolar disorder and severe depression, being prioritised for vaccination. The vaccination programme has already demonstrated agility in adapting to changing clinical advice, including the decision to prioritise the use of mRNA vaccines to those over the age of 70. The vaccine programme will make the necessary adjustments to accommodate the updated strategy, ensuring that those who are most vulnerable continue to be prioritised. The pandemic has been a profoundly challenging and stressful time. It is of vital importance that mental health services continue to operate during this period. Despite the increased strain placed on the healthcare system, specialist mental health services are continuing to operate at between 85% and 90% of pre-COVID levels. I am pleased to inform the Dáil that COVID cases in residential mental health care facilities continue to decline. As of the 19th of February, cases had reduced by more than half. The majority of cases that are being reported relate to staff rather than residents. The majority of eligible staff and residents over 65 in mental health centres have received a vaccination. Second doses have been administered to service users and staff in some centres. Progress is continuing to be made with regard to those that are yet to be fully vaccinated. In conclusion, Ceann Comhairle, this will be the largest vaccination programme in the history of the state. Remarkable progress has been made in a relatively short period of time. Our immediate priority and our complete focus is to look after the most vulnerable and our frontline healthcare workers who have worked so hard in the battle against COVID-19. They are being vaccinated as quickly and safely as possible. Supply of vaccines will be the only limiting factor. The vaccination programme will take a great national partnership to complete. Pharmacists, GPs, all doctors, nurses, paramedics, nursing home staff and many healthcare professionals, as Minister Donnelly outlined, have a role to play in the vaccination programme. We are now in a position where we have 3 authorised vaccines being used to protect our most vulnerable, something which would have been unthinkable until recently. I wish to thank everyone who has brought us to this point. The initial vaccine rollout is focused on protecting the most vulnerable among us, but as supply increases in the coming weeks and months, vaccination will ultimately be extended to everyone who wants it. Gaibh maith agat.